And we've hit a hospitalization record several times over the past 2 weeks. Hannah McDonald joins us live at Vanderbilt University Medical Center. And Hannah, this is concerning. We just can't run out of beds.
Right, and as you mentioned, we're starting to do things we haven't done since the beginning of this pandemic. And it's not only about beds, Amy, it's also about staff, and they're having a hard time holding on to healthy nurses, doctors, and other staff right now. The Tennessee Hospital Association had their president on with the governor yesterday to speak at that press conference. And Dr. Wendy Long said if our healthcare system becomes overwhelmed with COVID patients this winter, it could lead to even more hospital staff getting ill with the virus and then getting sent home to quarantine for some time. Some of that's already going on right now. Dr. Long said these are not concerns she normally has, and the situation inside hospitals is grim right now.
The spike in the new cases that we're seeing, combined with the increase in the average age of patients who are newly diagnosed, is creating an environment where we have an ever-growing number of families that are facing the reality of a seriously ill loved one connected to one or more forms of life support, whom they can't be with in the hospital, and who may or may not survive this illness.
Right, and no one at this hospital wants to see one of their own wind up as a patient. The state's health commissioner also was part of the press conference yesterday, and she echoed that staffing is a top priority. She said that there is $51 million available for hospitals to apply for, and they can use that money to pay overtime or put toward recruitment. But it's not as easy as it sounds, because right now competition is stiff across the board. Many hospitals in many other states are also worried about staffing. Live at Vanderbilt, I'm Hannah McDonald.